very common for patients to ask, am I a good candidate for your procedures? Typically, they'll call up on the phone and say, I have knee arthritis, am I a candidate? Similar to the physicians who will call me up on the phone and say, I got a patient with knee arthritis, are they a candidate? And I would comically start to say to them, that's about 1/10 of what I need to know to give you an idea if this person is, what kind of candidate this person is. But there are 4 distinct things that I found that are really important to consider when saying somebody is not a good candidate. Number 1, how severe is their condition? The prototype for this is the hip. Hips are different from all the other major joints. They're very complex with their connections to the pelvis and the back and the nerves, and the abnormal motions that are happening from the feet on up affecting the hip. The hip also physiologically has different healing mechanisms compared to other joints intrinsically in it. And this has made it sort of its own beast. And my first question of somebody that has hip arthritis is, have you had an experience where this is, kind of smoldering and irritating you for a long period of time? Is it still doing that? Or did you have that particular day where everything fell off the edge of a cliff and all of a sudden things are very bad very fast? Because I've found that if they've gotten to that point, they maybe have a 20% chance of regenerative injections working. And that's very specific for that part of the body, but everywhere in the body I have something similar for that from a severity of degeneration perspective. Another area that makes somebody not a good candidate is if they have very severe neurologic dysfunction. As I've talked about in other locations in my website, there are 6 levels of the neurologic system that I assess on everyone. And if there's very severe dysfunction that I don't think that I can improve with the regenerative injections, I think from an integrity standpoint, it's my responsibility to tell the person, you have a neurologic condition that is affecting your condition, your current painful condition, and if I can't heal that first, we're not going to be able to fix your other area. And that is how honest I am with patients. I want them to know what they're getting into and what the good, bad, and possibilities exist, not just hyping up stem cells, stem cells, stem cells. And that comes partly from having done this as long as I have, seeing the fantastic things that can happen, but also the failures that can happen. I don't want to give somebody false hope, because that's the only thing worse than no hope. The third thing that I found that it makes somebody a poor candidate is their total body or local chemical niche, the physiology of the person. Smokers, I require that they stop smoking for at least 2 months before I will do a procedure on them, because 10 years ago I tried it on somebody, probably 2 or 3 people, and all of them did very poorly. I don't want people to waste their time, their money, or their hope on a condition, on treating a condition that is not likely to heal. This is true also of hormonal balance, immune system, gut function, nutrition of the cells. That's the entire chemical niche of the body. And if that's in very poor shape, it's unlikely for healing to occur that's going to be meaningful for that person. And then the fourth thing that I found that makes somebody not a good candidate is what's happening here and here. If a person is angry, if they're stuck in a place where they just feel like they can't have any hope and they're grasping at straws to try to get somebody to be the proverbial white knight to come in and save them, despite themselves, regenerative therapies don't work very well. The placebo effect itself is 1/3 to 1/2 of all outcomes. Just being positive and hopeful is 1/3 to 1/2 of somebody's outcomes. And that happens between a person's ears. I can encourage that and I can help that along, but I can't make somebody change their mind. If somebody has, very deep injuries emotionally that are getting in the way of or directly contributing to their current condition, and they're unwilling to or unable to address those things, it's unlikely that a regenerative procedure is going to be a good solution for them. So I try to look at each of these 4 things as part of my assessments of somebody and improve them as much as possible to get the best outcome possible.